So I'm going to be showing you what I call the core connection series. This is a great way to start off if you're recently postpartum, even a couple of days, if you've had a recent back injury, or if you're just looking to get back into some movement and exercise but need a foundation to start with. So what we're going to be focusing on is getting this core, pelvic floor, diaphragm, all of the abdominal muscles front to back, coordinating with our breath. So truly our core system is in this entire system from that pelvic floor, actually all the way from our breath through here. So what we're first going to talk about is this gentle movement, what just happens as we're moving. So when my diaphragm is here, we have our rib cage, and then the diaphragm actually comes all the way around through the back area here, and it kind of looks like an upside down jellyfish, and it's very large, and it attaches actually all the way to some of our some of the lumbar segments back through here, and even has some connections with our hip flexor psoas muscles. So when we take a breath in, our chest expands, our lungs expand, diaphragm drops down. So think of that jellyfish idea. If you want to, you can imagine like an umbrella expanding all the way around. So it's expanding forwards, sides, and even back a little bit every time we take a breath in and down. So when we exhale, that everything comes back up. So in an inhale, diaphragm drops down, all of the abdominal contents and pelvic contents drop down, pelvic floor drops down just a little bit. So on an inhale, this is happening. And on an exhale, things are coming back up generally. So we're just inhaling, dropping down, expanding, lengthening, and then exhale, everything's coming back up. So we're gonna practice that breath first and foremost. So I would recommend laying down. If you need to, you can have a pillow back here. So laying down onto your back, have your hands around that rib cage if possible, and you wanna feel this space behind your low back here. You want to find neutral a little bit. So if you find that you're really flattening, you're tucking your glutes under and you're kind of on back here, tucked, see if you can let that go a little bit, and just see if you can let your hips tilt forward a little bit. I usually recommend to put your hands just right on those hip bones, find that bone in the front, and just kind of tip forwards and backwards a few times, and see if you can find the middle. In the middle, I should be able to slide my hand underneath my low back a little bit here. So once we're in the middle, good time to just focus on taking that nice inhale in, expanding into the belly, even into the back and sides. And then I exhale. Everything's technically returning back to where it started from, but that's a really good time on that exhale to just focus on letting everything relax a little bit. So when I inhale in, sometimes what I see people do on that inhale is they'll go and really arch their back forward, and they make a bigger arch back here. Remember, there's expansion into the back when we take that breath in too. So we're inhaling into the belly, back. I'm getting a little bit of pressure into my back, and sides a little bit. And I'm not getting pressure into my back by just tilting backwards. I'm staying still in that neutral spine. So I'm getting that 360 degree all the way around expanding of the diaphragm. Inhaling in. Belly back sides, exhale, softening and letting that go. Sometimes you need to prop your head up quite a bit just to let that back area feel like it can get a little bit of expansion in through there and get those rib cages just to come down a little bit. So you can always prop your head up a little bit more. So find that breath, inhaling into belly, back sides, down into pelvic floor, and then exhale, softening. The other thing I will often see is when someone's taking that breath in, they'll breathe up into their shoulders. So, and when we do that, think of the diaphragm here, it's instead of coming down on that inhale, it's coming up on that inhale. And why that's a problem is because we're never really getting that pressure down into our core system, which then helps us to actually basically counteract that pressure with this nice contraction. So if I'm breathing up this way, everything's kind of coming up and staying stiff. So what I tell people to imagine is that you have just like light sandbags on your shoulder here. So just a little bit of pressure down onto your shoulders so that they can't come up much. That'll help to direct that pressure a little bit more downwards. You are allowed to let your chest move. So if you're thinking like, oh, I only have to move at my belly, like no, your chest is allowed to move too. the rib cage. Everything moves out and forward and back. That concept's really important to get down, not just kicking everything on, focusing on that breath first. And then the other thing I was gonna mention too, if you're having a hard time keeping the breath just out of here, sometimes what helps a lot is actually just leaning forward a little bit. So I'm not just leaning forward through my back, I'm kind of leaning forward through my hips a little bit. And from there, I can sometimes get that expansion a little bit better into my belly, back, and sides. And exhale, softening. Same idea as the pillow, kind of propping your head up a little bit. It's just kind of helping connect this area a little bit more. So try that. That's part 1, and we're going to keep going with the series here. But part 1, just as a review, it's practicing that inhale breath of expanding belly, back, sides. Everything's expanding just a little bit. Slight downward movement onto pelvic floor. And when I exhale, I'm just kind of letting everything go. Truly what's happening is diaphragm and pelvic floor are just coming back up to their resting position. So stay tuned for part 2.